So if you're wanting to engage in some CBT therapy and you've heard the term formulation, but you're not quite sure what that is, then this video is for you. So I'm Lauren Bell, I'm a cognitive behavioural therapist and EMDR therapist. So formulation is a really key and fundamental part of all cognitive behavioural therapy sessions. And the reason that it is so key and so fundamental is its aim is for both you and your therapist to develop a joint understanding of you and the problem as a whole through the formulation process. So there are two different types of formulation. So you can do what we call a longitudinal formulation. So that's a formulation that really looks into the deeper, kind of more inner workings of you and the problem. So if we're longitudinally formulating, we'll look at things like early experiences, rules for living, core beliefs. And like I say, that can really give you this kind of much more clear understanding of the key underpinnings and vulnerabilities that might make you more susceptible to this problem in general. The other type of formulation that you can do is what we call a maintenance formulation. So maintenance formulation is all about getting you to understand the day-to-day kind of thoughts, feelings, behaviours, and general vicious cycles that potentially maintain the problem as a whole. And what we tend to find is that if we can give you an understanding of this maintenance cycle and help you to see some of the things that are potentially kind of keeping you stuck or feeding the problem, that will then give you the ability to kind of recognise the areas that need to change. And then basically formulation should then be used by you and your therapist as a springboard for the rest of treatment. So the idea is that all therapeutic interventions should be linked back to the formulation with a clear kind of rationale and reason for doing them. So if you're getting taught a technique by your therapist and you're not quite sure why, a really good question to ask is what part of the formulation is this targeting? And if the therapist is kind of doing therapy effectively, they should be able to let you know, A, what the technique is, B, what part of the formulation it's targeting, and C, how it should help if done effectively. So if you found this video helpful and if you want to receive some more information about formulation or CBT as a whole, please feel free to drop me a direct message. And if you want to keep up with some further therapy techniques and tips, then hit the follow button and I will keep you posted with more techniques as we go.